Okay, I would like to welcome everyone to this special episode of the System Podcast. We are honored to have Professor Anas, a renowned expert in anatomy from the prestigious Barra University, Kano. In this program, as we all know, Professor Anas is our father in anatomy, and he also have a YouTube channel, which I'll also link in the description, which he has been generously teaching anatomy, especially the field of neuroanatomy. And also, I just heard his long-awaited book will be coming out, which will also be great for you people to have your hands on. So, sir, I would like to formally welcome you to the program, sir.
Thank you very much, Yehuza. Thank you.
Okay. Now, let's start with the basics. Sir, can you briefly explain what anatomy is, why it's considered the bedrock of medicine?
Okay, so thank you very much, Yehuda, for having me this time around. As you ask, and you asked about anatomy and why it is being considered as the bedrock of medicine. Let me be frank with you. Anatomy is not only the bedrock of medicine, but it's the bedrock of virtually all the science courses, especially in the field of life sciences. When you talk about biology, when you talk about chemistry, biochemistry, bioanthropology, all this field of life sciences and what have you, anatomy is the bedrock of all the subjects. The reason because in anatomy, when you talk about anatomy, you're talking about, it's a combination of Latin and Greek, but this mainly Latin word is like you're talking about, the study of the structure of an organism.
Yes.
And when you talk about an organism, you're talking about be it an animal, or a plant. You get you? So even plants, they are part of the organisms because the plants, they also have life. So it's like the study of the structures of any organism, be it an animal. The animals may likely be smaller animals or larger animals. For example, you are talking about the microorganisms. The microorganisms, now you talk about the bacteria, the viruses, the fungi, the protozoans, and so on and so forth.
Yes, sir.
These are the microorganisms. When you talk about the macroorganisms, that is the larger animals. We talk about the human beings.
Yes.
And the non-humans. That is like the sheep, the goat, the cows, and so on and so forth. Chickens, dogs, and so on and so forth. So these are the larger animals. So the study of the structures of such organisms, be it small or larger ones, that is what we call anatomy. And actually, they include the study of anatomy to the function of such structures as part of the study of anatomy. So you talk about the study of the structures and functions and the relationship with those structures, So like you can combine the study of the structures and function and the relationship of any or part of the structures to each other. Like if you want to say, okay, I want to study a human being, for example, you want to study any part of the human being, like say you want to study the upper limbs or the lower limbs or the trunk, that is the chest. So if you study any of this part or the whole part of the body, so you have to relate any of these parts to each other. For example, you want to relate the upper limb with the lower limb.
Yes.
You want to relate the chest with the abdomen, or you want to relate, the function of any of the organs, internal organs like the heart, and its own structures. You get my point?
Yes.
So that is what we call anatomy. So in anatomy, whether you study either the plants or you study the animals, either small animals or large animals, it's like in the life sciences, you have to know these structures and their own function.
Yes.
Before you now proceed to any other thing related to that life sciences.
Yes.
For example, if you want to know, the biochemical components of an organ or a system or any part of the body, you have to know the structure first before you now know the biochemical component of that, or part of the body. And again, if you want to know the behavior of any organism, you also have to know what structures make that organism before you know its own behavior. So this is and that is where actually in medicine, if you don't know the structure and the function, you are going to get lost.
Yes,
And that is where anatomy is considered as the bedrock of medicine. Not only medicine, as I told you before, is the bedrock of all the life sciences courses. You get it?
So thank you very much, sir, for that illustrative explanation. And you have actually showed us that it's truly the bedrock of medicine. Now, sir, you have a wealth of experience in teaching medical students and non-medical students for a while. So I would like you to briefly take us through how the teaching of anatomy have evolved over the years and due to the coming of technology. I know before it used to be chalk and board, and now projection and so many things.
Yes.
So, sir, can you take us through briefly how it has evolved?
Okay. Well, actually, briefly, the evolution of anatomy teaching, it's just like the way anything you see in the world now has been evolving. So also any teaching, or the lecturing aspect of any, thing that you think of in an institution, it has evolved seriously. So the same thing with anatomy. Anatomy previously, let me just take you as far back as 2,000 years back, or even 3,000 years back before Christ.
Yeah.
So in those days now, people were learning anatomy in a cruder way.
Yes.
It's like that time there was nothing like anesthesia. There was nothing like all these drugs that you can give person to quench, the pain. So people were just trying to dissect animals or dissect human beings while they're alive. You get my point?
Yes.
So they were just using people that were sacrificed. For example, maybe people that committed a crime and they were prosecuted.
Yes, sir.
Instead of that particular government to execute such kind of people. So those scientists in those days now, those people that were supposed to be executed, instead of them being executed after prosecution, they were handed over to the scientists to dissect their own body while they are still alive to see different structures. So you can see from those period of time, up to the time when people started thinking of how to use dead bodies instead of living organisms. You get it? Instead of cutting the people alive to dissect their own body and see what is inside and see the structures and what have you. Now people started thinking, why should we be using living individuals? Why can't we be using dead people? And even the dead people now, the scientists didn't start using the dead human beings. They were using dead animals.
Okay.
Instead of using living animals, either sheep, goat, or human beings.
Yes, sir.
They now shifted to using dead animals before finally. And the reason why they didn't start, probably maybe with the dead human beings is because of the spiritual kind of a thing. People, even in those days now, they were able to, protect the dignity of the dead people, even the human beings, even after death. Each people you see in the world now, they have their own culture.
Yeah.
They have their own tradition of the way they now take care of their own dead ones. So even in those days now, people who were not even happy or free to, sacrifice their own dead ones for scientific studies.
Yes.
So it was later on, through, consultations, through enlightenment, through education and what have you, people started, especially in the Europe, started, making some advocacy visitations to people and, inform them what are the benefits of, sacrificing or donating your own dead one to allow the scientists to study those ones. So people started donating their own body themselves or donating their own family members and what have you for the scientists to study them after death. So that was how anatomy teaching started. People started cutting the bodies of those dead ones. And initially the theory, this is what I was telling you, was the practical aspect. And the theoretical aspect, initially people who were using only leaves to write on the lips, with the ink that was produced using maybe the charcoal and what have you.
Yes, sir.
Up to the time when, writing materials like the pencils, the biros and what have you started to be manufactured by the, developed worlds. As we were started, they migrated from using, ink on the leaves, then from ink to papers. When papers were started to get produced,
Yes.
and then they migrated from ink to maybe writing pens, like pencils, spiros, and what have you.
Yes, sir.
Pens and papers. So, and later on, the teaching people, in those days now, they are just sitting around a teacher to get the knowledge. Up to the time when people started coming to maybe under trees, maybe in the shade and what have you, they will be using a paper or a card, large card, to write, with that ink or with a pen or whatever, for people to see, to learn from that subject. Up to the time, after the coming of Jesus Christ, when people started using a board and a chalk, to teach in a classroom rather than studying under the tree or under shade or whatever. Now, the teaching now started evolving, migrating from blackboard and chalk. So it started evolving from that to the whiteboard and marker. You get it? And so the whiteboard and marker is not as long as people think of, because there's no more than 30 to 40 years. You get it? Especially we in the African, like myself, I can tell you clearly, I learned my anatomy using chalk and blackboard.
Okay.
So, but in the recent time, now in the last 20, 30 years, even we can say up to 40 years back, people started using whiteboard and marker. And now the teaching has evolved, has changed, shifted from using whiteboard and marker. Now people are using projection. Teachers, in anatomy, or any other field of medicine, people are using projectors.
Yes, sir.
To project the slides, on the screen or on the wall for the students to study. Previously, during our own time, there was also like internet.
Yes.
There was nothing like phone. There was nothing like all this social media, projectors and what have you. So we are only learning through libraries and through teaching of that, chalk and blackboard and what have you. But with the advent of this social media of the thing, you can see students are now using YouTube channels.
Yes.
To study anatomy and any other course. But again, not only that, the lecturers, they also come to classes with the PowerPoint, slides.
Yes.
To show them through the projectors and what have you. And so not only that, and now with the advent of this AI, people don't even need to, to waste their time using the actual slide projector, in the class. Students shift to using AI to study anatomy in 3D form.
Yes.
So you can see even the learning of the human body now is, you can learn it in 3D in the AI, rather than only using ordinary 2D slides on the board. You get it?
Yes.
So actually, for the last 2,000 years back, not only anatomy, any other scientific field of study, has tremendously evolved. But anatomy actually has greatly evolved to the extent that people that were finding anatomy learning so much complex, now the advent of this teaching guidance, teaching facilities,
yes, sir,
have now made anatomy teaching and learning much, much simpler and better than before.
Yes, sir. So thank you very much for clarifying this. I think you are, some of our teachers used to say coming of AI is making students not to this, but contrary. You are contrary to them, and I'm glad to hear this. And I'm sure many people too glad to hear. So, sir, in the just concluded MBBS exams, sir, there's one question which you gave, which was a clinical anatomy question. And I saw many students quite complain that this thing actually it's supposed to be
the clinical side.
So, sir, can you elaborate with how students can approach it using his anatomy knowledge?
Well, actually, the reason why lecturers or teachers in anatomy tend to give these clinical anatomy questions to students of level 300, is for them to get acquainted or get equipped with some of these clinical scenarios.
Yes, sir.
You see, anything that medical student will learn in the preclinical site, right from level 1, 2, 3. Whatever that student learns from this preclinical period definitely is going to assist him in the clinical side. So the essence of bringing these clinical questions in exams is to equip the students to learn more about what is going to happen in the clinical side. And as I was telling you, we are just preparing medical students from the preclinical side for them to learn more about what they are going to see practically in the clinical side. So, let me just give you a typical example of some of the questions that we do give. If supposing now somebody asks you in exams that Chinyere, for example,
Yes, sir.
had an accident and Chinyere had a laceration or cut on her face,
Yes.
and the Chinyere is just bleeding profusely in the face. You get it?
Yes, sir.
And also Chinyere has another laceration on
The score.
the skull. You get it?
Yes, sir.
And the bleeding also is also profuse in the skull there. But then after some times, that on the face stopped and that on the scalp doesn't stop.
Okay.
So the anatomist can ask in the exam, why do you think that bleeding in the skull refuses to stop while that of the face stopped? You get it? That is one scenario.
Yes, sir.
And then after some 1 or 2 weeks, the wound in the face healed within few days, while that of the scalp refuses to heal. It healed later than that of the face. So these are the two scenarios where an anatomist can ask students in the chemical side. So ideally, you need to have knowledge of your anatomy for you to be able to answer such questions. For example, now we know that the face is fully vascularized, well vascularized. You get my point?
Yes, sir.
And that the connective tissue in the face is not as dense as that of the skull. So when somebody has a laceration on the face, the blood vessels can easily retract and cause the vessels to stop bleeding.
Yes.
Within no time. While that of the skull, because we have a dense connective tissue in the skull,
Yes, sir.
so once there is a laceration, the vessels in there, they have inability to retract easily. And that is why when once somebody has a laceration there, the person can easily bleed unless you put a compression pressure over the area of the laceration. That's the only way the bleeding can stop. Allow the person to just be bleeding.
Yes, sir. So it means with your knowledge of the blood vessels of the anatomy,
exactly, yes.
you are expected to know.
Exactly. So you need to know the anatomy for you to be able to treat that person clinically.
Yes.
And for you to be able to explain to the person clinically why did his wound heal earlier in the face than that of the scalp. So because the face is fully vascularized, so for wound to heal now, you need to have a lot of blood supply around that area.
Yes, sir.
And wherever you have less blood supply, actually, the wound may not likely heal as fast as the area that is fully vascular. What was I saying?
So you were talking about how the blood vessels in the brain.
Yes. So as I was telling you before, actually, the knowledge of anatomy is very, very essential, very, very important for students to be able to treat the patients in the clinical side. So by the time you know this at your fingertip, in the clinical side, now anytime a patient comes to you, you'll be able to explain to him why does that thing happen?
Yes, sir.
Why does that thing does not happen? You get my point? So
yes, sir.
The knowledge of anatomy is very, very important. So it's like this clinical scenario are very much important for you to be able to, try to answer certain scenarios in the clinical side.
So, sir, we are almost going to the end of the program.
Yes.
Now, looking ahead, sir, what do you see as the future of anatomy education and research? Because some people feel like there's nothing more to actually discover again in anatomy.
No. That is very wrong notion or understanding, for people, There's like anatomy, there are still virgin areas in anatomy that people are yet to explore, especially in the field of molecular anatomy. or molecular biology. Molecular biology is part of anatomy, it's a branch of anatomy. So it's like people have shifted from, studying the gross anatomy itself.
Yes.
Now they are just digressing from the gross anatomy down to the molecular level. And now molecular biology is the one that is now excelling worldwide. If you look at the biotechnology area, biotechnology field and what have you, these are such areas where anatomy knowledge is very, very important. Because we are studying the structure of the organisms at the molecular level. So now, and these are all anatomy. So it's like the future of anatomy is bright.
Yes, sir.
There are so many things that we are yet to discover or to find. Let me give you another example. The virgin area that are yet to be explored by especially in the African countries.
Yes, sir.
The bioanthropology. Bioanthropology is not known until quite recently, especially in the African countries. So bioanthropology is also a branch of anatomy, which is dealing with the measurements of body parts or the whole part of the body.
Yeah.
So you're talking about the measurement of the, upper limbs, lower limbs, measurements of the organs, either using, physical measuring materials or using, the X-ray or using ultrasound or CT scans or MRI, medical resonance imaging and what have you.
Yes, sir.
You can take a picture of any part or whole part of the body and then make some measurements and then, find out correlation or relationship between one part of the body and another.
Yes, sir.
And then make an analysis, about maybe, or you make a prediction about maybe one part of the body, predict whether it is going to predict either age or sex, or height of an animal or a human being or whatever.
Yes.
So these are some of the areas that our people are not yet conversant with. Until recently, when people have started knowing that anatomy is there are some virgin areas in anatomy where people can study.
Yes.
And as I told you, especially in the field of molecular biology, there are so many things that people are yet to study. And, molecular biology is very, very, the creative area.
And I must say, most of the disease now, people want to know the molecular relation.
Yes.
So because that's how they will tackle it.
Yeah.
Easily.
You tackle the disease using the molecular aspect of it. Yes, that's it.
Sir, I would like to thank you very much for taking time part of your very busy schedule to promote our program, at the same time help the student clarify some couple of questions.
Yes.
So, sir, as we wrap up, sir, I would like a final message from you, where you give a final message and also give a brief advice to students, with the coming of AI and so many things, how best to study anatomy or to revise anatomy, because I believe even if you are on the clinical side, as we said, is the bedrock of medicine, you have to be revising. So how best to revise and to study anatomy in the final thoughts, sir?
Yes, actually, let me just say this, and I've been saying this to my students. Anatomy is a very complex subject, even previously. But now, as I told you from the beginning of this interview, I told you that because of the advent of this, teaching materials or teaching facilities, AI or what I mean, anatomy teaching and learning is becoming simpler nowadays.
Yes, sir.
And there is no way a medical personnel or paramedical personnel can escape anatomy, whether in the clinical side or in the clinical side, or wherever anatomy study or anatomy scientist is, you can never, ever escape anatomy. Wherever you go, you must apply the knowledge of anatomy. Even if after graduation now, as a medical doctor, you have to be referring to anatomy notes or anatomy books.
Yes, sir.
For you to be able to explain or understand certain diseases and how they come into being and how they are the pathogenesis, how they can be diagnosed, how they can be treated.
Yes, sir.
So for you to be able to understand the anatomy very well, first and foremost, you have to regularly be reading anatomy. Anatomy is not like any other subject. It needs some revisions every now and then. So you have to be revising your notebooks, and then you have to be revising your textbooks. Anatomy learning on the internet alone is not enough.
Yes.
You have to learn anatomy just like before. You have to be reading the anatomy from the textbooks.
Yes.
You have to be also watching some of the anatomy videos because they are available.
Dissections.
You have to be also patronizing your practical sessions, like in the museum, or also you have to go to the museum and see some of our plastic and other models in the museum. You also have to also be going to our practical, sessions like the dissections and what have you.
Yes.
Combining the reading from the textbooks with the patronization of the practical sessions, either from the dissection or from the museum, that will make you a better anatomy learner.
Yes.
And again, apart from learning from the textbooks, learning from the dissection, learning from the museum, you also have to be watching the videos. Previously, there were nothing like videos.
Yes.
But now, because of this, YouTube content, videos are really, really helpful, especially for students that are going for examination.
Yes.
So if you are going for an oral examination, like let's say tomorrow, you are not expected to be reading your textbooks a day or so before the exams. What you are only expected to do is to revise the topics by watching videos.
Yes, sir.
Or by listening to the audios. There are some anatomy audios. Those ones will really help the students to pass their own examination.
Yes, sir.
You get my point? So actually reading anatomy is everyday activity. It's not that you read it today, you leave it tomorrow, you read it maybe after you come back. No. If you want your anatomy to stick in your head, you have to be revising it even now and then. Because as I told you before, you need anatomy in any field of medicine. Be it internal medicine, surgery, also pediatrics, pathology, all this even in community medicine, you need the knowledge of anatomy. You get it? So it's like anatomy is everywhere. So students must learn anatomy in a better way. If you are reading anatomy, you have to also keep an atlas by your side.
Yes.
You cannot just be reading the theory without being referring to the atlas. So for good or better students, they keep the text by the side and then the models or the atlas of anatomy by the side. As you are reading the text, you are also referring to the atlas, or you are referring to the models, either the cadaver or the plastic model. So that will surely help you for the anatomy learning to stick into your brain. Otherwise, you may not be able to understand much.
So, thank you very much, Prof. And also thank the listeners for tuning in. And I also like to advise everyone to stay curious and explore anatomy to its depths, because it's the bedrock of medicine. And I also suggest you subscribe to help the algorithm push it to more people. So until next time.
Thank you.